the ovary, of which all women have two of them, are organs that are beside the uterus, made up of three different cell types. And during life, any of those three cell types can undergo malignant transformation to develop into a cancer. And that's ovarian cancer. Importantly, cancers of the fallopian tube, which are attached to the ovary, or the peritoneum, which lines the abdomen and pelvis, are very similar cell types as the ovary and are often grouped together as an ovarian cancer because the symptoms are the same and they're treated the same. Unfortunately, we don't know the exact etiology or cause of ovarian cancer. We do know that certain women are at increased risk based on their family history or other risk factors. But basically, the cells in the ovary undergo a malignant transformation and then spread outside of the ovary. A malignant transformation is when the cells become a cancer. Approximately 1 in 80 women will develop ovarian cancer, and it is the leading cause of gynecologic death for women. So yes, they should be worried about it, and particularly because ovarian cancer is called the silent killer. Many women don't have persistent symptoms of cancer until it's already spread outside of the ovary. So women need to be in tune with their body, listen to the symptoms, and if they are having the symptoms, have that addressed by their physician. Symptoms of ovarian cancer are very vague. They consist of bloating, abdominal fullness or pelvic fullness, getting full when you eat very quickly, even if that's only small amounts of food, a change in your bowel habits or urinary pressure or urgency, feeling like you need to go to the bathroom frequently. So unfortunately, they're not good screening tests for ovarian cancer. Unlike we have the pap smear for cervical cancer or the mammogram for breast cancer, we don't have a standard or recommended screening test. However, there are tests such as an ultrasound or CA-125, which is a tumor marker in the blood that can suggest you have an ovarian cancer. There is a link between ovarian cancer and breast cancer. About 10% of all ovarian cancers as well as breast cancers are genetically driven. So if you're one of those women that does have that genetic mutation, you're at increased risk for getting one or both of those cancers. It is treatable. Unfortunately, again, because this is the silent killer and the vast majority, 75 to 80% of these cancers are diagnosed at an advanced stage, the overall survival is less than 45%, 5-year. However, the disease is very treatable. The most important way to reduce your risk is, again, for a woman to know her body and to be cognizant or aware of any changes or signs and symptoms. Other things such as birth control use, pregnancy, breastfeeding, having your tubes tied or removed, those can also decrease your risk of getting ovarian cancer. The average age is in the early 60s. However, those women who get ovarian cancer due to a genetic mutation may develop their cancers earlier in life. And mostly it's in Caucasian women, although African American women tend to have a worser prognosis. So the most important thing is that you seek out the care of a gynecologic oncologist who's a specialist that's been trained to manage ovarian cancer. We have very good studies that have shown that your survival is better, as well as you get the more appropriate surgical management if a gynecologic oncologist is involved in your care.